Hi, I'm Dr. Paul Davidson. I'm a bariatric psychologist from Brigham and Women's Hospital and Harvard Medical School, and I'm here to answer your questions about weight loss. For a long period, obesity was not seen as a disease state, and as you said correctly, it was assumed to be some tragic character flaw of the individual. The American Medical Association in 2013 finally shifted its position to state that obesity was a disease state, a chronic condition. And in doing so, I think what happened was it started to recognize the primary biological basis for the condition that has very strong genetic and hormonal contributors. It's important to recognize that this is not necessarily a bad thing. It's become perceived as a bad thing, but the notion of storing fat effectively was always a wonderful thing in terms of survival of the human species. And as I tell people very often, for most of human history, weight was great, because weight was what allowed us to get through the famines and through the droughts, the times we went on the hunt and didn't get anything, or we went to fish and didn't get any fish, or a crop failed. Nowadays, we don't have to rely on that so much because we source the entire world for food, and we can get almost anything we want at our local grocery store. It didn't used to be that way, so the ability to maintain it was great. What happens though is that with recent environmental changes, some of the social shifts, medical changes too, along with a very dramatic change in lifespan, we're living much longer than we used to. And as a result, we have time to develop these kind of chronic conditions and comorbidities that come along with obesity. For example, diabetes, high blood pressure, cholesterol issues, and so on, the breakdown of knees, low back pain, and so on. So I think this is part of what comes with having a chronic condition. And I salute you for taking steps to try to shift that. And I know, after working with thousands of patients, it is incredibly difficult to do so. I think one of the things that might be helpful for you to do in working through is, first of all, to let go of your guilt and shame. That doesn't help anything. Once you recognize that it is a chronic condition, that it is a disease state, it's not necessarily something that came of your doing. It's not something you ever wanted, for sure. And that when you start to see your steps to lose weight as a more positive way to kind of take your present and future into your control, you can start to feel very, very good about that. The problem with chronicity is that it doesn't stop. You have to stay focused for the long haul. And in my work, I do primarily work with individuals who have bariatric surgery. They have the best long-term results. It's the most effective and durable means of treating it because you're taking a biological solution to try to treat a biological problem. However, even with that, people have to commit to lifelong shifts in food intake, they have to commit to hydration, they have to commit to physical activity and so on. And if you can accept the fact that it's lifelong, it's not as hard. When I was in second grade, I had my eyesight checked, and it turns out I wasn't seeing the board that well. So they said, you need glasses. So I got glasses. I wear glasses, I'll wear glasses the whole rest of my life. It's a simple thing, but it's that daily focus on the fact that I need to do something else to help deal with this chronic condition that allows me to live the life I want.